Well, hello everyone. Good to see you all. Just before I start, I was put in mind yesterday with the funeral of Baroness Thatcher, our former Prime Minister, students of literature will recognise the quotation, "The past is a foreign country, they do things differently there." And certainly as we're now 18 days into what is arguably the biggest reorganisation of the National Health Service in England, and I was put in mind from Jason's point about being able to see Tartan from space. David Nicholson famously said that the current reorganisation is so big you could see it from space. So let's see how we get on 18 days into this, but what I wanted to reflect on was some elements from the past in terms of improvement that we need to learn from, in both positive and opportunities for learning and challenge, and think about how we move forward in the context of a very different landscape for health and social care in England. So just let's reflect on where we've come from, and certainly my own experience of having run 3 NHS organisations in the northwest of England before I took up this role, most recently Chief Executive of a large teaching hospital in the northwest. When we think about the big improvements that the NHS as a system has made, and I think about what I spent an awful lot of my time on, and there was an awful lot of focus on, there are 2 things that stand out for me. The first is the significant improvement we've seen over the last 5 years on waiting. And waiting for patients, which arguably is a key marker of experience and quality. I remember speaking to patients who were waiting 18 months, 2 years for heart operations back in the mid-90s, and now 18 weeks is the norm. And the drive that we've had on waiting times over recent years has been significant. And you can see from those graphs how much progress that we've made as an NHS on this issue. And I think it's really important in times of upheaval and times of challenge, and particularly following the events at Mid Staffordshire and the Francis report and so on, that we remember that the NHS has made major achievements in terms of progress, but there is significantly more to do. But looking at those graphs, you can see that from the mid-90s, and students of history may remember the first term of the last Labour government putting in significant sums. Tony Blair famously on Frost on Sunday committed to matching European levels of spend on healthcare, and we saw during the late 90s and early 2000s significant investment in the NHS, notably on staffing, reducing waiting times, but with that came a lot of redesign, a lot of improvement. There was a lot of investment in setting standards nationally for cancer and heart disease, and lots of work to make sure we met specific outcomes guidance, and that in turn has led to significant improvements. And if waiting was one of the big ticket issues that we had to deal with in the English NHS, then infection prevention was another. And you can see there the significant improvements in both MRSA and C. difficile over the last 5 years. Significant reductions in relation to those areas. And that has led to a major reduction, and this is, again, with the suitable warnings around data. This is crude mortality, but you can see the significant reduction we've had over the last 5 years in hospital mortality. When you consider the significant mortality rate associated with infection prevention, that is really significant reduction, but I'm sure that has gone along with some of the other major programs of improvement in relation to cancer diagnosis, stroke care, many improvements that have come on the back of the investment that's gone into the NHS in England. The challenge we've got is how do we sustain and take those forward in a climate where resources are scarce, where we're operating in an environment of flat cash, where we're not seeing significant growth. So, what do we learn from that? from the past? How can we utilise the learning from the last decade to create even broader, faster change? What are our priority areas, and how should we organise our resources for improvement? So, from the 1st of April, we're 18 days old, NHS Improving Quality. We've brought together, for the first time, all of the improvement organisations that previously operated on the pitch into one entity, aligned with the goals of the NHS. And you can see the list of organisations that we've been born from, all of whom have had strong track records in improvement and delivery and achieved a great deal. Now we marshal our efforts in order to move forward to align with the key priorities of the NHS in England, which are as follows. 5 domains contained in the outcomes framework for the National Health Service in England. And those 5 domains relate to preventing people from dying prematurely. We still fall behind European partners in relation to premature death. Enhancing quality of life for people with long-term conditions. Significant work to do there, although much good work has already been done by the Long-Term Conditions Development Programme, which has seen major reductions in length of stay and reduced admissions. We need to work to make sure we take all of the good work of our predecessor organisations forward. Helping people to recover from episodes of ill health or following injury. And the last 2, crucial, ensuring that people have a positive experience of care and treating and caring for people in a safe environment and protecting them from avoidable harm. That's a huge agenda, and there is much to learn from other colleagues and other healthcare systems in taking that forward. We've taken literally hundreds of improvement programmes that existed in the NHS in England and distilled them to 10. And those 10 programmes align with the 5 domains of the outcomes framework to give us a route forward in relation to taking improvement to the next level. I haven't got time to take you through all of those, but there is a degree of overlap and similarity to colleagues from the other countries that make up the UK. In addition, with the new system, which puts £80 billion worth of NHS funding in the hands of the new clinical commissioning groups made up of primary care physicians in local communities, determining what to spend on the needs of their population, we need to build their capability and capacity for driving improvement and delivering outcomes. And those areas that we need to focus on include the 5 domains, but we need to work with each element of the new system to ensure that we build capacity for improvement across the commissioning side of the National Health Service and the provision side of the National Health Service. So working directly with groups of hospitals and organisations to help support them to drive improvement across the 5 domains, and particularly in patient safety and patient experience. Now, how we do this matters, because if we've learned anything from the past, it's that targets work to an extent, but it's not just about hardcore performance management. In terms of how we deliver things, we need to think about a much greater sense of purpose and engagement across the whole health system, with different parts of the health system coming together to work hand in glove. And what we've learnt about change, we've put all in one place. And that includes 7 components that surround the importance of a shared purpose. And those include the importance of innovation and spread. There's some fantastic examples of good practice in individual parts of the English NHS, which arguably haven't been spread rapidly enough. And when we think about the big issues of waiting and infection prevention, it took us some years to achieve those results. We need to be able to do that faster and do that at greater scale. And if I was to pick one other thing from the diamond, it would be the importance of engagement. Deep engagement within communities, within organisations and amongst staff, and particularly with patients, to deliver extraordinary results in relatively short timescales. Those are the challenges that we face. And if I was to finish on a final note, picking up the literary theme I started with, I'll take my favourite quote from Robert Browning, which is, if we were to achieve all this, man's reach should exceed his grasp, or what's a heaven for? Thank you.